you very much. It's lovely to be here today. I think it's been an absolutely fantastic day, and I hope I can add some value to what's been a really good set of conversations. I think there are nearly 200 council areas now signed up to be dementia-friendly communities, but I did hear the comments earlier on about, well, I didn't see that when I went there, or it's not like that where I live. And I think it's quite a big ask, isn't it, to have a dementia, something that you could genuinely call a dementia-friendly community. So it's great people have signed up, but I'm sure there's plenty of work to do. Councils on their own, of course, can't do this, but I think there's a leadership role for councils to play. So I want to talk a little bit about that just quickly in not too many minutes, bearing in mind the time. I just obviously pressed the wrong button, so I'll just press this button instead. Hang on. Right. I think we've had some of this background already. Dementia-friendly communities are those where people with dementia can carry on living their lives, basically. And councils deliver social care to people, but they're also community leaders, and they're supporting all sorts of other services in the community: housing, roads, parks, leisure, and all the things that people want to use and access. People also want to access other things. They want to carry on going to the local choir, or the things they did before they got a diagnosis of dementia. And one of the roles for councils and others is to work, to make sure people work together to enable that to happen. So a dementia-friendly community basically is one that you can carry on living in when you've got dementia, and you can live in it comfortably and safely. Councils do have a role to play, and they are local system leaders, and this is councils of all tiers. So I used to work in a county council, and we did a lot of work with people with dementia. We commissioned social care, we linked with the voluntary sector, we commissioned Alzheimer's Society and others to support people. But also district councils, town councils, all sorts of community levels. People can do things which enable their community to support people better. And there's some really good examples I think in Suffolk, there's just one village that's done a really huge amount to support people with dementia, and it's often about individual effort. But local political leaders, not just leaders, but individual councillors, constituency councillors, town councillors, county councillors, also can play a role. They are community leaders. They can give people a pathway if they would need a little bit of funding or a bit of support to get something going. There are many people in our communities who are willing to help do things, but they don't quite know how to start. And there's a role for the council to not always do everything, but to enable things and to set the scene for things to happen. They can't do everything, especially in these straitened times. I couldn't mention councils without mentioning the shortage of money that they've got. However, there's something about using money to best effect, and that is about using all the resources at your disposal, including people with dementia themselves, because they are great people. I've been really impressed by people contributing today and what they're doing to help themselves and their friends in their local communities. Look at public service providers and commissioners is another role for councils. They're also planners. So, how's the housing set up? How are the streets? How's the signage? Are there obstacles on the paths? Do we make it easy for people to get around? And they are, in some cases, regulators and employers. So there are lots of examples where the council leadership extends to working with others, the Chamber of Commerce, and we have in every upper tier council a health and wellbeing board. Health and Wellbeing Board brings together councils, social care, and sometimes providers and voluntary sector as well, all of which have to put in place a health and wellbeing strategy. It's the kind of place where you might set a dementia strategy as well. And your priorities in your health and wellbeing strategy, I know certainly in the area I worked in, dementia was one of the priorities. And, having it in a strategy is not the answer, is it? But it's a starting point. I am very much in favour of not just having it in the strategy and seeing action. So I liked all the statistics we saw earlier, but what I want to see is, well, so what do we do because of that and about it and to help people on the ground? And the development of policy much more generally about, there's work on health in all policies. It's not just health in all policies, it's kind of how do our general policies affect the way people live their lives? All people, but yes, people with dementia as well, people with disabilities. How we set things up make it harder or easier for people to engage in their communities and to carry on living? How open spaces are managed? When new things are introduced into the street scene, is it done in a way which makes it easy for people to navigate and to understand? So the LGA, Local Government Association that I work for, has produced a guide for councils to help them support communities to become dementia friendly. I think you've all got one in your packs in the bag. It's a booklet, and you can take them back, and if you don't need it, give it to your council or your local councillor, because maybe they need it to help fulfil their role. And it seems to us that there are 5 main groups of activity where councils can help, and I've put them up there: place, voices, people, resources, and networks. All of those things are important. I'm just going to briefly go through a couple of those. So, and these are just examples. Of course, you've probably heard many more examples today. But councils can check the accessibility of their own areas, but they can also engage with people with dementia to walk the patch. If you're in a town council or a village council, you can walk around the area and see what are the issues if you've got dementia. It's similar to when people are looking at disability discrimination, and they, perhaps what you need to do is go out in a wheelchair and see how hard it is to get around. Well, go walk the patch with people with dementia and see what the issues are for them. And when I say walk the patch, it could be physical walking, but it's also about understanding from people's perspective. It's that kind of, it's not always walking along the street. It's seeing things from the other person's point of view. And work with partners to make sure that places are accessible and that high streets are working well. And this is, of course, where some of the national work comes in. But national work with chains, and I hear the problems with chains of stores and banks in some areas. That's great, it sets the scene. But some shops aren't part of chains, they're little local stores. So who's going to do the work with them, to engage them? Maybe they can be brought into dementia friends programmes with council-trained dementia champions or local Chamber of Commerce dementia champions, all sorts of ways to do it. And do you know what? Most people in a shop in your town know someone or knew someone that has dementia, and if they don't, they will. And actually, so it's of interest to everybody. It's something people can relate to. They may not be able to relate to it themselves, but they will see it, and it helps them to not see it as a problem. And that's why the work that Angela and others do in schools is really important, because those children, some of them, have grandparents or other relatives, and if it becomes normal to them to not treat granny or grandpa or uncle or mum or whoever differently because they've got dementia, then it becomes more normal for the adults around them as well. So children can teach adults lessons too. I mean, I think we know that. I'm straying off my text here. I'm prone to doing that. So voices of people with dementia, this is really critical, of course, enabling people to have a voice. Some places do it well. We've got organisations like Health Watch that can help with that in some places. The voluntary sector itself, DEEP, I've just been in the session run by DEEP. I mean, all these organisations that are really helpful in helping people to have a voice. But councils should also be willing to help, and they should be willing to listen to people with dementia and people with other conditions in their committee meetings and in the consultation meetings they do to understand things from their point of view. And particularly, they need to ensure that consultations on key issues, which are for everybody, not just for people who haven't got a condition. So if there's a consultation about a change in your area, the library, the swimming pool, the road, then people with dementia should be able to participate in that as well. And they should be co-producing policies, services, working with people with dementia. They are the experts. So that experts by experience, nothing about us without us, those sorts of approaches to policy making. Councils can train their own staff. Their staff can train other people in communities. For example, in the council I used to work in, a couple of members of staff became champions. They trained the Care Providers Association, who then trained other people. And you can create a kind of cascade effect of training. And Dementia Friends training it's just about awareness, but it's amazing what a difference it can make to someone who knows nothing very much about dementia or is afraid of it. And they can provide information for staff. They can also, of course, enable staff who get a diagnosis to continue working if they wish to do so and are able to do so. Because we were hearing in the other room about just because you get a diagnosis doesn't mean you are a different person the next day. You may want to think about how you adjust what you do and things, but you aren't suddenly different to the way you were yesterday. So if you were working or driving or caring for someone the day before, you probably don't need to stop immediately. I mean, you might want to think about it, but it's not an all or nothing. And so employment policies need to take that into account. And of course, employment policies really need to be cognizant of carers and the responsibilities that they take. Councils spend some of their resources, of course, on supporting people with dementia, and they need to work with health colleagues and need to make sure 2/3 of people with dementia live at home. Many of them will be supported by their families. probably the next biggest bit of support that comes in is not the health service or the hospitals and the episodes that we saw up on the screen earlier. It's people who are perhaps then accessing some voluntary sector support, we saw on the film, someone going to a dementia cafe, or maybe then some home care, maybe some day services, perhaps through a direct payment, continuing to be able to access things in your community. And those are the kind of things that council are doing. So I spend quite a lot of time in dementia meetings, and I spend a lot of time putting my hand up saying, don't forget the social care bit, don't forget the voluntary sector bit, don't forget supporting people's own homes, because that's where most people with dementia are. So it's good to have good hospital care, but it's also important that hospital care is not just about treating the dementia, it's about good medical support in the community and in hospital for people with dementia. And councils are partners on health and wellbeing boards, they work with health colleagues. If there's too much of a medical model in your area, council should be helping to address that. I have to say, I spend a lot of time with my hand up saying, don't forget this. So you have to keep at it. You have to be persistent. And I can see very much, and I've heard very much today, that many of you are very persistent, and so good for you. And we need to think about all the services that councils deliver. And networks, of course, are important. So many councils are part of Dementia Action Alliances and will have signed up. We've heard there's a lot of councils signed up to become dementia-friendly communities. And signing up is, of course, not enough. You have to sign up and then work out your action plan and how you're going to work with communities, with businesses and others to get there. And to use other things that you've got, like your health and wellbeing strategy, to make sure that they are playing their part in driving forward that support. And working with local businesses as well. Finally, I think what I've said is, people will sign up and it won't be the answer, and you may go to a place and you may not immediately be able to see why that's dementia friendly, because I think a dementia friendly community is the sum of many, many parts, isn't it? And each part is really valuable. So in Hampshire, for example, they've done work on dementia-friendly high streets. And, so that probably isn't in every high street in Hampshire, but there will be gradual movement for high streets in Hampshire to recognise that. And frankly, if you've got a dementia-friendly high street, it's probably friendly to a lot of other people, like carers or people with disabilities as well. Likewise, if you've done a lot of work with a community on being friendly to people with learning disabilities, I think it's all about awareness of difference and patience, isn't it? And understanding of someone who comes in that, is struggling a bit or has forgotten something. And that can happen for a number of reasons. So I think we need to be patient with communities that have the good intention and the will and the striving to get there. And we all, in our different roles, need to play our part in helping those communities get there. Some of it will be through national roles with banks and big national chains, and some of it will be with Fred in the local shop, and how can he help Mrs. Brown if she comes into the shop and isn't sure where to go home to, and I just as a final example, when I was working in Hertfordshire, we had some extra care housing for people with dementia, and it was in a small sort of village, or small town, I suppose. And the door, this was a place that had reaccommodated people who'd been in secure settings or care homes and hadn't settled, and they were in extra care housing. They had support, there's a care team on site, but they had their own flats and had lots of telecare or assistive technology devices to help them live. But the doors were not locked. So sometimes people went out, as they are entitled to do, but people in the local town would help them get back when they were ready. And sometimes people might sit in a cafe for a long time and, maybe a little prompt to go home at some point. But if you've got a community that understands, then you can make that work. And that sort of facility, I suppose, lends itself to that. It's much harder when you're at, number 9 Acacia Avenue living on your own, and it means that more people need to have more awareness. And that's what I think we're all here for today. So thank you very much.